It's those balding patches and that receding hairline, and you're wondering, what can I do about it? Well, there's definitely hope, and it's called a hair transplant. Dr. Malde is still answering some of the frequently asked questions, and remember, we are going to be taking a look at those in just a moment, as well as showing you before and after photographs of some of her patients who've been through some of these transplants. But going back to what we're talking about, Dr. Malde, and welcome back. What are some of the fears and concerns that patients have before, you know, they walk into that room? Because you can see everybody's like, oh my gosh, I wouldn't even imagine what it's like.
True. I often get questions asked like how painful it is. That's the most common question.
Yeah.
So everybody fears that pain, and like I explained, it's not painful. I would say it's not painful at all.
Yeah.
Slight discomfort while giving the anesthesia, but post that, no pain at all.
Okay.
Even post the transplant, we put you on a 5-day medication, which includes painkillers. So I often find my patients walking back into the clinic after the transplant, and they're completely normal, completely fine.
Yeah, right.
But yes, other questions that I get asked are, you know, how long it will take, how long the results will take.
Yeah.
And then obviously it takes about 8 months for the hair to grow. So I often have my patients calling me every month asking me where their hair is.
Right.
But I also get some absurd questions once in a while.
Yeah.
You know, will I get brain cancer? Or
right. Okay, but it's still a question, right? It's a legit question. Am I going to get brain cancer?
No, I mean, how?
Yeah.
You know? I also get questions like, is it going to affect my brain? Is the anesthesia going to go into my brain? Yeah, and stuff like that. But
okay, Joshua from Kirinyaga is on the line. Let's find out if he's also concerned about getting brain cancer after a hair transplant. Joshua, good morning.
Good morning to the daktari.
Yes,
I do not have any fears of getting cancer.
Right.
Because number one, Shiko, and I have 3 questions for daktari.
Right. Monitor up, please.
What has landed us where we are as human beings is interfering with nature itself. So if at all your hair is fading away, or probably you're balding out of natural causes,
yeah,
I don't see why I should bother myself trying to graft my hair from my back to my forehead.
Yeah.
I mean, it's simple. If you're growing old and you're losing your hips, you don't start looking for other hips to pad on your waist to look younger. That's number one. Number two,
yeah,
I think I understand where the doctor is coming from, because when someone says that, you know, your hair really, if you lose your hair, then you're bound to lose your dignity and probably your physical aesthetic value. But then someone else will also come and tell you that if you're losing your eyebrows, or if your cheeks are not chubby, you're also losing your dignity. So I understand that bit. Maybe what I want to ask Daktari is, how natural is this? Because at the point when you tell me that you're getting my hair from the back, yet it is my body that has decided to do that. Naturally, if at all it's not out of any medical complications like cancer,
yeah,
I mean, unless I'm really not getting or understanding the meaning of the word natural. What is natural is that balding. What is not natural is you plucking hairs from my back and flattening it on my forehead.
Okay.
I need that clarification.
All right. Okay. So did you hear Joshua's concern? I hope you heard that.
Yes, I did.
So he said, so how natural is this process? Because, okay, he says it is a natural process to be balding. So isn't it an invasive method, rather, just trying to do the whole transplant?
I would say it's invasive, but it's natural in the sense that we're only removing your own hair and reimplanting it.
Right.
Again, we're not depleting the donor area. I'm so glad he's confident that, you know, he is okay with balding, but most men are not. I mean, it's such a concern to men these days that they want to restore their hair, they want to look good, they want to look confident, and most men also feel that, or even women for that matter, feel that they're not confident because they don't have that hair. And is it not natural to have a head full of hair?
Right.
Yes, you do go through the balding process, but it's natural to have the head full of hair as well.
And we've got some images up there of the before and afters that we promised you that we'll at least be sharing with you. Pretty clear examples there. You can see what it looked like before. You can see what happens after the transplant. When we talk about expectations and realistic timelines, Dr. you've talked about 8 months. to expect to see the full growth, right? Could it take longer? Could it take shorter, depending on the individual?
Well, not really per se. There's some science behind it. The hair follicles go through a cycle, and it often takes 4 months to actually start seeing results. So at 4 months is when you see about 50% growth, and then on there's a slow progressive growth. And that's why I said 8 months in the beginning, because at 8 months is when you see 100% growth. But yes, there is that slight variation wherein, you know, sometimes we see patients who have started growing their hair in the 9th month. They don't have anything up until 8 months, and they're obviously super worried about it.
Yeah.
But yes, it does vary from person to person. But all in all, between 8 months and a year, you get the 100% growth that we are desired to give you, and you know, you can, that hair stays for the next 20 years now.
Wow. Okay.
Yes.
Let's take a look at WhatsApp. I do understand we've got some questions, or at least comments coming in. Someone says, good morning, Doc and Chico. Good morning. My name is Chantel. My question is, which are the best hairstyles to avoid hair loss? Because I think combining natural hair now and then causes hair loss, or combing natural hair now causes hair loss. Thank you. Okay. What do you recommend?
I mean, you can't ask somebody to stop braiding and weaving. It's something most Kenyan women have been doing since, I would say, they're 6 months old.
Yeah, right.
But yes, do a little less of the pressure in terms of try and be a bit natural, try and do braiding once in a while.
Yeah.
Yes, you are going to see hair fall when you comb out your hair because it's so weak now, you know, after all that chemical and all that braiding. Yes, tips on how to maintain your hair naturally. I mean, I would say a little bit of diet change.
Right.
It's often so hard to eat completely healthy these days. But, you know, a few foods that would help and nourish the hair.
Yeah.
Stuff like almonds or nuts, for example, and fish, all of that. And I would say oil your hair once in a week.
Yeah.
I often find most women oiling their hair and leaving the oil for long periods of time until they don't wash their hair.
Yeah.
It's not so healthy actually because you're suffocating the follicles to a certain extent.
That's true.
Yes.
Yeah.
And
even the hair food that you are giving or putting on your hair matters. Don't you see some of the products that we do use tend to like clog the follicles?
True.
Not necessarily the best type that you would be using.
Absolutely.
Yeah.
I mean, anything too much is obviously bad anyway. So we should balance things out, try and do a mix of everything, which includes diet, hair care, packs or hair food as you call it, you know, doing oiling, often giving that exercise, leaving it natural for a few days, not doing anything to it at all for a few days. All of that in combination would slowly try and, you know, be able to restore your hair. But once you've lost and once there's that trauma, it's so difficult to actually, you know, regain all of that hair again.
Okay, so the best thing is to avoid the trauma. Another question, please, that we can share with Dr. Hello, Doc. Oh, wait, okay. In case of a burn on the scalp, is it possible for the procedure to be done too? This is Tete tuned in from Thika Town. Good question. If someone's actually, you know, suffered, you know, whether it's like a 3rd-degree burn and unfortunately that area has been affected, can the transplant help?
Yes, it can. We have done that before. And, well, obviously, if the patient has been burned completely and there's no hair on the head, then that's not possible. But if you do have the donor area, as I've been explaining, the back of the scalp, we can restore hair. There's often a few procedures that we do before to try and restore the skin in that area before we actually implant hair over there. Because once you've suffered a burn, you may not even have, you know, enough blood supply for the hair to grow over there.
Right.
But we've done cases wherein we've transplanted hair to burn patients or cancer patients for that matter as well.
Right.
And it has worked. It's successful.
Wow.
Yes.
Amazing. Another question, and then we can continue. Hey, Chico, I'm Maggie from Italy. I'm asking if all that someone has a genetic implication, such as baldness, would the hair really grow after the transplant, considering this person has a genetic reason for the baldness? Okay.
Yes, so as we promise and guarantee that we're giving you hair for the next 20 years, even though you have it in genetics to lose your hair, you may start balding again after 20 years, but it's not drastic balding. It's not that all the hair is just going to fall out in one go. It's going to gradually bald again, but that's fine. You know, the whole idea is we're uprooting hair from one area and placing it in another area. There's no reason for it not to grow. There's no reason for you to bald immediately. Balding is a slow process. It happens over a period of time. And that's why hair transplant is such an surety to most cases for anything for that matter, and obviously genetics for that matter.
Okay. All right. Now, it's very interesting that there is a aftercare and recovery process after you do get a hair transplant. It's not just a wake up and go type of thing. Daktari, what do you recommend for all your patients once you've had the hair transplant? There are the do's and the don'ts. Tell us. So
we have some immediate don'ts post-transplant. You know, we don't allow patients to wear hats, caps, or anything that's going to suffocate the hair for at least a month. We don't allow strenuous exercises, no gymming. No swimming for a month, because all of this affects the grafts or the hair that we've implanted. Post-transplant, we put you on a 5-day medication, which includes antibiotics, painkillers, antihistamines, and anti-inflammatories. All of this is just to avoid any kind of discomfort post the transplant. And apart from this, the patient really doesn't have to do anything, just let the natural course of hair to grow. However, you know, patients are supposed to come in for what is called a PRP, platelet-rich plasma. This is a 1-hour procedure post-transplant, and the first one is done after 1 month of the transplant being done. Ideally requires 3 sessions, so 1 every month. Now, just to explain in short, this is fertilizer for the transplanted hair.
I like that,
So, well, we're just trying to give the hair some nutrition and allowing it to grow at its best. So, yes.
So you have to make this conducive environment for it so that it can grow.
Absolutely.
Okay.
Absolutely.
I also was concerned for such cases, Daktari, as someone who, for example, is living with alopecia. And in some cases, it's that alopecia totalis who would be of concern here, because if you have no hair 100% all over your body, you know, because in such cases, you'll see no eyebrows, no armpit hair, no leg hair, no nothing. How then does this hair transplant seem beneficial to someone with alopecia?
Unfortunately, we can't do a transplant because the whole idea is to get your own hair from one area, and if you don't have hair anywhere, I mean, I personally avoid getting hair from anywhere in the body apart from just the head itself. But yes, there are doctors who would use hand hair, armpit hair, chest hair, or beard hair for that matter. But then again, if you're talking about alopecia universalis, then there's no hair all over the body. Where are you going to get the hair from? So unfortunately, a hair transplant is not possible. However, we do something called biofiber, and if somebody really wants that hair, then we're using artificial hair to implant into the scalp. But then again, this has its own complications. There's chances of rejection. That hair only lasts about 5 years. So a lot of limitations, and that's why we avoid it most cases. And then I think the person just has to accept that, you know, they're going to be that way. But however, if there is alopecia just to do with the scalp, then yes, there are medications that have been researched on. They're obviously not for alopecia specifically. They're used for certain cases of arthritis, but it's just you know, a different way of using the medication, and we found out that it's actually helping hair grow back onto the scalp. So yes, we have treated a few patients wherein they don't have hair at all on the head, and we've regrown the hair naturally just through medication. So yes, we can do it, but not a transplant.
Not a transplant.
Yes.
All right. As we begin to wind up, do we have any more questions, Bona Director, that we can share with Daktari? Okay. Well, someone says, okay, let's say you are not bald, you just have a forehead. Can you cover the forehead with a transplant? You have to love the audience. Okay, she'll get to that in a second. Let's see another one. People are making you smile this morning, yeah? Hello, Shiko. I love the topic today. Kindly, doctor, explain on eczema. My baby has had it. She loses her hair after swimming or using some hair oils. Interesting one. Jane from Kasarani.
Hi, Jane. Eczema is not my forte.
Yeah.
I would recommend you see a dermatologist and actually get to know more about how to treat the eczema.
Right.
But yes, it is affecting your baby and her hair, so I think we should be able to restore it in some way or the other.
And by the way, is this procedure recommended for anybody, like, you know, a toddler, an infant? I don't think it would be recommended,
No,
right?
No.
Yeah, so underage, no.
No, nothing below the age of 18, because again, you know, we don't know. I mean, obviously we have to do a few evaluations as to why, you know, a kid has lost their hair so much. And that's often just in cases of alopecia totalis.
Yeah.
But we would have to do some evaluations, but we don't allow transplants below the age of 18 unless it's completely necessary.
Right.
And then of course we have to go through the entire process of having consent from the patients, and then, you know, often what happens is kids, when they grow up, they go against the decision what their parents took for them. So we don't allow it in most cases.
Right, right. Okay, they should be able to choose for themselves.
Yes.
All right, more questions. I can see them coming in. Go ahead, Bona Director, let me know. Okay. So as they're working on that, Daktari, the questions that arise around issues to do with quack practitioners and very botched procedures out there, resulting in failed transplants. What do we need to keep in mind, by the way, on how to pick the right specialist, the questions to ask when you walk into a procedure room just to inquire about a transplant? Because I feel it's still a very green area, especially in this country, you know, having a hair transplant. What do I need to keep in mind?
Keep in mind a lot of things. You obviously need to have trust in where you're going. Obviously know qualifications of the doctor who's doing the procedure.
Yeah.
But all said and done, obviously we have Google with us, and I think a lot of people come in with you know, basic knowledge of how a hair transplant works.
Yeah.
And even if you log on to our social media pages, you know, we often try to educate the crowd and know what to expect up in hand before even coming in for a consultation, just to give them idea, just to educate them on how a hair transplant works. Quack practitioners, I would say no, there aren't any out there, but I would just say that yes, there are other people who are trying to give all sorts of remedies for hair restoration, and then you know, people have this fear that hair transplant will not work because your Jamaican black magic castor oil is going to work and regrow your hair.
Yeah.
But you know, all these things, yes, said and done.
Yeah.
Yeah, I think you just need to have basic knowledge of how a hair transplant works, and just know that it's a natural process, as I've been saying.
Yeah, because, it shouldn't be anything additional, being put.
No,
right.
Absolutely.
All right. My director tells me that we've got some more videos from the procedure room that we can share with our viewers. And just take a look, and that you can see right there is Dr. Malde hard at work in the process of a hair transplant. Dr. walk us through this video. Is this now you numbing the patient? Interesting to note that the patient is not asleep at this point.
Yes, like I explained, we're giving local anesthesia, and that's what I'm doing at this point in the video.
Yeah.
What I'm doing is blocking out that area with local anesthesia.
Yeah.
And I think you just saw a few minutes ago that the patient woke up and he was like, so he's completely fine, he's painless, there's no pain actually.
Yeah.
And there you go.
Yeah.
So we're just blocking out that area, anesthetizing, and once it's numb is when we start the extraction, is what we call.
Right.
Well, you can see that when we are doing hair transplants, we have to shave this area because all we're trying to do is just get the hair follicle.
Oh, wow.
Yes, and our machine is really small, and all we need to do is just pluck out the follicle from that area. Now, this area entails us to get, you know, anything between 2,000 to 5,000 hair.
Right, so that's the donor area. Like
that is the donor area, yes.
Okay.
And in his case, we got about 3,000 follicles that enabled us to cover most part of it.
Right.
Just walking you through this, we're removing the follicles from after what we call punching.
Yeah.
So we've done extraction through that machine.
Yeah, is it almost what you would think of as like a super leveled tweezer?
Absolutely.
That's extracting,
Yes.
you know, the follicle and the root.
Yes.
Okay.
You're right. Actually, it's called a punch, and you know, if you can relate to the punch we do for the papers, you know, you're kind of creating that channel for us to just pluck out the follicle. You can see how small our machine is, and there's going to be no discomfort whatsoever.
Okay.
Obviously, the area is numb, but again, you know, there's nothing extensive that's happening. It's completely less invasive, or you know, a minor procedure, what I'd call.
Yeah. And of course, as we continue to share those pictures with you, remember, viewer discretion is advised. You know, some people might find that a bit too graphic. But nevertheless, like you said, very simple procedure. Dr. we do know that there are more questions coming up for you. So I want us to tackle maybe one or two before we say kwaheri. Bona, Director? Okay. Morning, Shiko. What if someone has thin hair? Where will she get the donor hair from? Good one.
So like I explained, the donor area is still quite thick. It's still quite healthy in most cases, 90% of the cases. However, we do have other treatments wherein we do stuff like just the PRPs or stem cell therapy, or we do collagen induction so as to build the donor area again. And then we can use the donor area to re-implant in the recipient area or the area of baldness. But all said and done, if somebody just has some thinning hair just in the scalp, then we can just do PRPs and collagen induction, and that can actually help just thicken the hair, which is actually thin. Yeah.
All right, someone had requested us to tackle the issue of hair loss around the temple area, or at least the hairline for women. But think about that as we look at what Francis is saying here. He says, very good discussion. I have gray hair and same time based. Okay, what's the cause of the gray hair? Can it be implanted?
Well, graying is an aging process. We can't stop that, and unfortunately we yet don't have the technology to make your gray hair black again. Yeah. But yes, we can implant that gray hair. It just means that when we implant gray hair, the new hair that's going to grow is going to be gray as well. Okay. And I often find patients asking me, like, I don't want my gray hair. Yeah. But that's the only solution. The only thing that you could do is possibly color it or dye it and make
because
it black
you're already
again.
at that phase in your life where, yes, you're now graying.
Exactly.
So, yeah, okay, fine.
Yes.
Good one, good one. I'm liking the feedback. I've even put a pause on some of my questions because I can see there are so many coming. Hello, Shiko. How can one prevent hair loss when you realize the problem is starting? Perhaps lifestyle?
So, yes, lifestyle, of course, but we do have quite a few less invasive procedures. It doesn't necessarily mean you have to do a transplant. As I explained, we can do stem cell therapy, we can do collagen induction. Right. We can even just start you on something basic like supplements. So it's not necessary that you have to do a transplant if you started the balding process. Okay. And that's why I say it's always best that you come into the clinic and we evaluate and give you the best option possible. You know, we don't want you to just go out there and spend your time and money on doing something that's not necessary.
Absolutely.
So I often get questions on phone or, you know, on SMS and asking how much it is and them trying to evaluate on their own. And I always, you know, insist on the patient coming in for a consultation. So I can explain to them everything. It takes me 45 minutes for a consultation.
Right.
And, you know, that's the best way that I can explain to them what's the best way forward for them.
Yeah, and then for them to make a decision.
Absolutely.
But at least it's an informative one, you know?
Yes.
Last question, Dr. Malde, and then bye-bye. Why one boy from Limuru says, hello, Shiko, please ask Doc if chin hair for ladies can be permanently removed?
Yeah,
I'd
I'm sure
like to
it's
think.
removed.
Okay.
Yes, it can. Whether it's black or gray, we have innovative technology now, which is called laser, laser for hair removal.
Yeah.
And it's called a diode laser, wherein it's just, you know, run through your skin, wherever it is, be it the chin, the face. I mean, we have ladies coming and doing it for the entire body now.
Wow.
Because I think most women prefer to be hairless apart from the head.
It's true. I can relate.
But yeah, so yes, chin hair is possible to remove, and I think that's one of the concerns for a lot of elderly ladies, because you often see just 2 or 3 of those just hanging out there and just being so prominent. But yeah, we can remove them.
All right. Yeah. It wouldn't be fair to let you go without giving our viewers the opportunity to reach you directly. I mean, that's why we do the show anyway. Dr. Malde, how can they find you?
We're located in Parklands in Nairobi, Sky Mall to be precise.
Yeah.
And if you look up Tia Clinics KE, you'll find us on Instagram, you'll find us on Facebook. We have a website, tiaclinics.co.ke. And yeah, you can find us, and we have our contact numbers there as well. However, you can call on 0799 995716 to book an appointment directly.
All right. All right, and so there you have it. We sure hope that this particular discussion has been helpful. Thank you so much for the questions that have come in. Unfortunately, that's all we have in terms of our time for health and wellness. From me, Shiko Kaitani, of course, Dr. Malde and the entire team. Thanks a lot for being with us for the past 1 hour. So it doesn't stop here. The Daily Brief is up next. Have a wonderful day up ahead. We'll see you soon, bright and early tomorrow. Dr. Malde, thank you.
Thank you too. Thank you so much.